The so-called RAP study, that's the Radial Artery Patency study, made a fairly big splash several years ago when they reported that in this randomized trial that radial artery patency was superior to saphenous vein patency for a 1-year interval in patients who were receiving an internal mammary graft to the LAD and in whom the radial artery or saphenous vein artery were used to target either the RCA or the circumflex. A paper in press in JACC now presents the 5-year results of this particular trial. And again, the protocol was relatively straightforward. Each of these patients received an internal mammary graft to the left anterior descending coronary artery. And then a radial artery graft or saphenous vein graft was assigned to either the RCA or the circumflex in a random nature, so that every patient received both grafts going to either the RCA or the circumflex, and the number of grafts to each of those vessels was approximately equal. So an interesting study, and the question is, at the end of 5 years, was there indeed a benefit? And when one looked at graft occlusion, then in fact 13% of patients who received radial artery grafts were occluded, whereas 20% of patients who received saphenous vein bypass grafts were occluded. So data that deal with graft patency, but not necessarily clinical outcomes. The anticipation would be, however, that enhanced graft patency would lead to a reduction in major adverse cardiac events. So I think some very powerful data that in patients with triple vessel disease undergoing coronary artery bypass graft surgery, that the radial artery graft really should be strongly considered in preference to saphenous vein bypass graft whenever possible.